Today we're going to talk about what Western medicine gets right. What Western medicine gets right. And we're going to talk about where it falls short. But before we do that, we want to give you a little background about Western medicine. So Western medicine is also known as allopathic medicine, and it's also known as conventional medicine. And it refers to a system of healthcare that originated in ancient Greece. Okay? And it has evolved over the years. And Western medicine is what we have here in the United States. So that is what Western medicine is. Now, there are many things that Western medicine get right. Okay? Western medicine has saved lives. It's saved many people's lives. And it has its limits. So let's talk about both. We're going to talk about what the limits are and what the things are that it has really gotten right. But we're going to do it without shame, and we're not going to throw shade, okay? So Western medicine is really good at, and it excels at, trauma. And when I talk about trauma, what I mean is the kind of trauma that's like emotional trauma. So that's where some traumatic event happened, and then people have a hard time coping with that traumatic event. Or maybe they have events that happen in their lives that cause some emotional response and distresses them, over time. So it's about people's coping methods. Can get that right. It is about the coping methods that people have and how they cope with life in general. So that's what trauma is. And so Western medicine is really good at helping people with trauma. And it also is really good at diagnostics. Now, in the medical center here in Houston, there are, hospitals and clinics that have, some of the top of the line diagnostic tools, and they have diagnostic machines. And so they could, you got things going on in your body. They have the equipment that's needed to figure out, diagnostically what's going on. And they have the ability to do lab tests. They draw your blood, they can run analysis on your blood, and they can tell you what's going on in your blood to determine if you have some kind of issue or disease process that's going on with that. So Western medicine is really good at diagnosing. Definitely good at that. And the third thing I want to talk about that they are really good at in Western medicine here, especially in the United States, because that's what I have the most experience with, is that it is really good at emergency interventions. So if you're in a car accident, you're out and about and you broke a bone, something like that, or you need surgery, really quickly, it is absolutely good at that. It's brilliant at that. It is excellent in taking care of emergency situations. Now, where Western medicine falls short is that it is very, it lacks in being able to help people who have chronic illness. Now, if you got a diagnosis of what some people would call a chronic illness, Western medicine falls short in that area. They're not really good at taking care of people who have autoimmune disease. There is problems there. They don't understand, the Western medicine does not understand autoimmune disease processes. And the other thing is, Western medicine does not understand how to care for people with mental health issues. Mental health is a problem for Western medicine. And Western medicine has a hard time embracing what's called holistic prevention. Holistic prevention. Now, Western medicine often ignores the interconnection of the mind, the body, and the spirit that is connected with the person's lifestyle. Okay, so that is one of the things where Western medicine falls short. Now, over here where I am and where we are in the circle, we are looking at holistic healing. So that's going to be kind of the opposite of Western medicine. So holistic healing in the world that we are in, and in the world that we're in the circle, we don't shame people for using medicine. We do know people need medicine. However, but what we want to do is to get you off the medicine if at all possible. We know that there is a place for medication. However, it is not meant for you to have for the rest of your life, okay? So we work with getting people off medications, okay? That is one of our goals as holistic healing practitioners, okay? So we stay curious. So we would be the ones asking why. We would be the one that's asking to try to figure out what the root cause is of your illness, okay? Now, in holistic healing, we don't reject science. I know some people think that, we don't base things on science, but yes, we do. We actually work with science and we expand it. Okay, science has its limitations. However, science doesn't go into like spiritual realm or trying to look at, what is going on spiritually with a person or emotionally with a person that could be causing some physical illnesses or physical problems. So we take the science and then we expand on the science in holistic healing. And the other thing in holistic healing, where we are in the circle, we don't pick sides, okay? We're choosing what serves healing. Our whole objective is to help you heal. We are not here to help you manage a disease. We're here to help you heal the disease, okay? So that's what's going on in our world in holistic healing. Okay. So now this is not about East and West. It's not East versus West. There are things that goes on in Eastern medicine that does not go on in Western medicine. However, East medicine, West medicine, and holistic healing, they're all different and they all serve their purpose. Okay. But what's going on for holistic healing is we are about integration. We're about wholeness, bringing a wholeness to you. We're about balance. We're about reclaiming the wisdom that's been left out of the medical model that's here in America. Okay? So that's what we're about in holistic healing. So that's it about Western medicine. And, I am asking people to look at coming out of the medical matrix and look at another way of healing. Look at it. You've been doing the medical matrix for a long time. And all I'm asking you to do is look at the other options. Okay, you've been doing Western medicine forever because that's what you were taught. But look outside the box. That's what I'm asking you to do. And if you don't look outside the box, it's a possibility that, yes, you may have this disease for the rest of your life. But do you want to have the disease for the rest of your life? I don't think so. Most people don't, because it's uncomfortable. It's not a way to live. So I'm asking you to look outside the box, look at holistic healing, and just give it a try. All right. My name is Sharon Fant. I'm a registered nurse, and I've been working in healthcare in the medical field for over 38 years. So I have a clue of what's going on in the healthcare. So I invite you to look at a different way, okay? And I'll see you tomorrow at 7 a.m. Central Standard Time, okay?